Hi, I'm Roger Shih. I'm one of the physicians here at PartnerMD, and I'm also PartnerMD's Director of Medical Advancements. I'm here today to talk to you about an exciting new test that we are launching here at PartnerMD called OpenDNA Cardio Risk Plus. I'm here to explain to you what this test is, how it works, and why you might consider talking about it with your own doctor. OpenDNA is a form of genetic testing that looks at your genomic sequence and determines how likely you are to develop cardiovascular disease. It does this by analyzing the overall picture of point mutations in your DNA and compares it to the genomic sequences of people who have already had heart disease or diabetes or hypertension. By using artificial intelligence, OpenDNA can compare your genetic sequence to those other folks' genetic sequences and assess your overall risk. The test involves taking a simple buccal swab, in other words, a swab inside your cheek, and that's it. We send the results to OpenDNA, and we usually get results in about a week or so. So who should consider OpenDNA testing? If you're under the age of 40, then traditional risk calculations that we use to assess your risk using traditional measurements of cholesterol, blood pressure, and so forth, those equations may not be as applicable to you, and this test with OpenDNA can help us give us a better, more detailed look at your risk going forward. If you're over the age of 40 and are found to be low risk, but you want to know more, then this test can help us identify other potential risks for developing cardiovascular disease that could be missed by traditional risk calculations. If you're over the age of 40 and you need to consider the use of medications, but you're not sure about using medications to lower your cholesterol, then this test can help you and your physician determine if additional steps to control your cholesterol or other cardiovascular risk factors are in fact necessary. And it can help you and your physician understand better the overall context for your cardiovascular risk factors. If you're older or have an established history of cardiovascular disease, then genetic testing is not going to add very much to the overall clinical picture, and this test may not be for you. If you're interested in this test, talk to your doctor. Your doctor here at PartnerMD knows you the best, and they'll be the best able to help you determine if this test makes sense for you.